Hello everybody, welcome to another episode of Doc Talk. I'm Dr. Michael Bracchio here at Velocity Sports Rehab, and in this episode we're going to go over shin splints. Shin splints are a common condition, especially in the running community. They are considered to be an overload syndrome, which typically means that we've done too much too soon. The pain of shin splints is usually described as a deep ache located around the tibia, which is your shin bone. There are two different types of shin splints. The first type is called an anterior shin splint, which is felt on the outside of the tibia, and the muscles involved are the tibialis anterior, the extensor hallucis longus, and the extensor digitorum longus muscles. The other type is called a posterior shin splint, which is felt on the inside of the tibia. The muscles involved are typically the tibialis posterior, the flexor hallucis longus, and also the flexor digitorum longus muscles. The first step to treating shin splints is to reduce the load that we're placing upon the lower extremity. This means that we may need to avoid running for a few weeks so that we can decrease the pain of shin splints. However, during this time, we can substitute running for either swimming or cycling so that we can maintain our cardiovascular endurance. Another consideration would be to take a look at our shoes. Running shoes should be replaced every 250 to 500 miles, depending on the make of the shoe, because the materials of the shoe will tend to break down over time, which will decrease their ability to absorb force. Soft tissue therapy can be beneficial in the initial stages to help decrease the pain of shin splints. At home, you can either use a massage stick or a foam roller to help decrease the pain in the lower extremity. For anterior shin splints, you're going to focus on the muscles to the outside of the shin, which will mainly be your tibialis anterior muscle. For posterior shin splints, you're going to focus on the muscles to the inside of the shin, which will mainly be your tibialis posterior muscle. In the clinic, we can take a little bit more aggressive approach to manual therapy by either doing a pin and stretch technique or by using an instrument called Graston to help desensitize the tissues around the shin. Strengthening the muscles of the lower extremity is vital for recovery and prevention of shin splints. Strengthening these muscles will help increase their ability to absorb force, which means that it'll be more difficult to overload the tissues, leading to pain. Exercises for anterior shin splints will mainly focus on the tibialis anterior muscle. A simple exercise that you can do is resisted dorsiflexion with an exercise band. It is important that we build both strength and endurance in this muscle, so we'll want to do both repetitions and holds for this exercise. Posterior shin splint exercises will mainly focus on the posterior tibialis muscle, but will also involve the calf muscles as well. Two exercises that we can do would be either heel raises or resisted plantar flexion with an exercise band. Again, we'll want to build both strength and endurance in these muscles, so generally we'll do either 3 sets of 10 or we'll do 6 sets of 10-second holds. Kinesiology taping can also be beneficial in the treatment of shin splints. So what you'll need is 3 strips of kinesiology tape. The first strip is going to be about the length of your tibia, so I'm just going to measure here and then cut. And then you have 2 strips that are about 2 to 3 inches long. And so whenever you're using kinesiology tape, you want to cut or round the edges. That will just make sure that the tape sticks a little bit longer. So we're just going to round our edges here. And so we're going to start with the long strip first. So if you have anterior shin splints, you're going to tape along the outside of the shin. If you have posterior shin splints, you're going to tape along the inside of the shin. I'm going to tape for anterior shin splints. And so what I'm going to do is I rip the backing on the tape, and I'm going to lay my anchor down towards the bottom of my shin. And then I'm just going to lay the tape along the outside of my tibia there. And I didn't put any stretch on the tape, and I'm just giving it a little rub here to make sure that it sticks to the skin. And then I'm going to take my smaller strips here, and so you're going to put them where you have the most of the pain. So most people have most of the pain on the bottom third, And so what I'll do is I'm going to lay my anchor down, and then what I'm going to do is I'm just going to gently push my anterior tibialis muscle towards my tibia, and then roll over and lay the tape down on the other side. And then I'll take my second smaller strip, again ripping the back, place my anchor down again, and then just gently push the anterior tibialis muscle towards the tibia. And then I'm just going to give it a nice little rub on the tape to make sure that it sticks to the skin. And so this is what the final product looks like. Thank you guys for tuning in to another episode of Doc Talk. I hope that you found this video useful. If you did, please give this video a big thumbs up and don't forget to subscribe to our channel.